All right, see you later. Okay, so why don't we get started? Marco, you ready?
Yeah, anytime you're ready.
Okay, so it's a real pleasure to welcome Marco back to UBC. Just saying he completed his PhD here in 2003 from UBC, and let me see if I can get the title right. The chief. Written on your slide. There it is. I can use the cheat sheet. Chief Economist and VP of the Health Policy Institute.
And some of the broader lessons learned from somebody who's not been in academia, but has been doing health services research, trying to help policymakers solve problems. So as Craig said, I left here in 2003. I did a PhD in economics with the legendary Bob Evans and Tamal Amia. And then I spent some time at the World Health Organization in Geneva in the Department of Human Resources for Health, basically working on health workforce policy problems in developing countries. How do we retain health workers in rural areas? How do I ensure payment models incentivize prevention versus treatment and stuff like this? So that was an interesting adventure. At that time, there was lots of open space in terms of research agendas and data sets, so that was exciting. I then spent several years at the World Bank, where I met Peter. Leading, my last position there was leading the Global Health Workforce Policy Program. Again, focusing on research applied to low-income and middle-income settings, and trying to help policymakers make evidence-based decisions. And then I switched gears. The last 8 years I've been in Chicago. I've been actually created the Health Policy Institute, which is, we are a team of 13 staff. It's a think tank housed within the American Dental Association, but it's not a typical trade association think tank that starts with the answers and then backfills it with data and evidence. It's been a very interesting challenge to build this up, to get the right staff, to make collaborative relationships with academia, as you'll see here. I was very aggressive in forming partnerships with some of the leading health services researchers in the US. And basically trying to answer questions related to access to dental care. And why aren't people getting more visits to the dentist or to other healthcare providers? So that's been interesting. Also, I didn't know much about this field before I took this job, and it's been a very interesting niche. There's been so many, I would say, unanswered questions. There's a whole set of data that's become available. So we've developed quite a, I would call a robust and fun research agenda. And so what do I try to do in my group? And I'll tell you I picked some examples from my career and under this broad theme of evidence for decision making with policymakers, and all that with health services research.